Perinatal mental health distress looks different for everyone. Let's explore what it feels like for some people. Some people will experience many symptoms at the same time. Some may experience one or two. Getting support early is vital. Churning stomach and no appetite. This mum is early in her pregnancy and is overwhelmed with anxiety. She has strong somatic symptoms, including a churning stomach and little appetite. Constant anxious thoughts. She's consumed with worry and anxiety, including that she will be a terrible mother. Unable to sleep. Her racing thoughts are keeping her awake at night and she's becoming exhausted. Confusion about pregnancy. Her distress has become so acute, she has started feeling like she may have made the biggest mistake of her life. She is contemplating termination of a very much wanted pregnancy. They are struggling. This new mum has very typical depression symptoms. She is crying frequently for no apparent reason, but it's long past day 10 after birth when baby blues ends. Low mood and sadness. Her mood is very low. She has little moments of feeling okay, but most of the time she feels very sad and flat. Cognitive symptoms. Her brain feels foggy all the time and she has trouble thinking clearly and making decisions. Exhausted. Her energy levels are very low. She just wants to sleep all the time, but sleeping doesn't seem to help. Dad is worried and stressed. Her partner is so worried about her and very stressed himself. He's had to take a lot more time off work than they had planned to care for her and their baby, and he's worried about losing his job. The highest risk factor for new or expecting dads to experience perinatal mental distress is if their partner is unwell, but the system is inconsistent at engaging dads or non-birth parents, and there are additional social barriers for men to seek help. Confused and bewildered. He's never seen his partner like this before. 30% of panda callers have no prior experience of mental distress, making it difficult for those affected and their loved ones to recognise as a potential mental health issue, especially amidst the major life transition that is new parenthood. Birth trauma. This new mum experienced birth trauma. She is having flashbacks of the birth, which is just one of the potential symptoms of birth trauma. Her family and friends are focused on the baby. She had an emergency cesarean birth and everyone else is just relieved the baby is fine. Trouble bonding with baby. She is having trouble bonding with her baby, which is a common impact of birth trauma and many forms of mental distress. Psychological isolation. Despite having great practical support from her own mother, she is feeling psychologically isolated and unable to share her inner thoughts. Emotional numbness. She is feeling generally emotionally numb and dissociated, unable to feel her feelings. This is a common symptom of trauma and many other forms of mental distress and illness. She feels like she is faking it. Afraid to be alone with her baby. One very present feeling is fear and overwhelm at the thought of being left alone with her baby. Anxious but minimizing. This partner is feeling high anxiety, but constantly minimizes their exhaustion and distress. Minimization is common and often driven by mental health stigma or fear of judgment or child removal. Men specifically can experience additional barriers to disclosure of distress, feeling they have to be the rock for their family and not wanting to take the attention from the birth parent. Fear for baby's well-being. This partner jokes about not needing sleep, but the truth is they're experiencing constant fear and anxiety about baby's safety and well-being. They have started having scary, intrusive thoughts of something happening to baby, including that they might drop them. Muscle tension and headache. They are experiencing what are very common somatic symptoms, including headaches and muscle tension. They dismiss these as the result of tiredness and long hours trying to soothe an unsettled baby. Can't sleep when baby sleeps. Racing thoughts mean they are unable to settle down to sleep themselves, even when baby is asleep at night. Snappy and irritable. Here is an older mum who has very high expectations of herself and of parenthood. Her main outward symptom is irritation. She is uncharacteristically impatient and snappy with those around her. Guilt and shame. She feels like a failure. She feels guilt and shame for not enjoying motherhood. Won't leave her baby. She is overwhelmed by the changes in her life and struggling to manage everything in the way that she wants to, including caring for her baby. But she finds it impossible to leave her baby with anyone else, including her partner. Feelings of loss. This parent is struggling with huge feelings of loss of her pre-baby life, of her identity as someone who is always competent and in control. They are grieving the many changes that pregnancy and birth has brought to their body and loss of feeling attractive and their sexual well-being. Using alcohol to self-medicate. They are finding themselves increasingly wanting to drink to manage mood. They have always enjoyed a drink, but have found 1 or 2 glasses turning into a bottle every night. They feel guilty and play the drinking down. Alcohol use is widely accepted in mainstream Australian culture, but conversely also stigmatised. It's important to be non-judgmental in discussing alcohol use, but also to assess risk, including to baby and for anyone having suicidal thoughts. Shame. They are overwhelmed with shame and terrified to tell anyone about these experiences. Frustration and rage. This mum is deeply distressed. Her frustration and irritability have built up to the point of anger and rage. These are much less well known than low mood or tears as potential mental health symptoms, but we hear them very commonly on the Panda helpline. Urges to shake baby. Several times in moments of frustration, she has felt the urge to shake her baby. Constant anxiety. She is also constantly worried about her baby's health and well-being. Helpless and afraid to reach out. She feels so helpless, frozen with fear that someone will take her baby from her if she discloses the storm of thoughts and feelings inside of her. Intrusive thoughts. This young expecting mum's previous low-level anxiety is ramping up. She is starting to experience constant, vivid, intrusive thoughts of her baby dying, in her womb or during the impending birth, or of one of them becoming sick. Compulsive behaviours. She is trying to manage these thoughts with constant checking behaviours, monitoring her baby's movements, seeking constant reassurance from her caregivers, and hand washing and cleaning compulsively, impacting on her sleep and functioning. Unable to sleep. Even when she goes to bed, her thoughts are often keeping her awake. This is contributing to her distress. Terrible memories. Fatherhood has raised terrible memories for this dad, and the paralysing fear that he will become an angry, violent dad like his own father. Agitation and feeling wound up. His mood is agitated with so much tension in his body and a feeling of being constantly wound up. Drinking and taking risks. He is starting to drink more to manage his feelings and to engage in risky behaviours like drink driving. He's deeply distressed and feels helpless and hopeless. Suicidal thoughts. The feelings are becoming intolerable and he is avoiding being at home. When he is there, he's always on his phone or watching TV, zoning out to distract himself from his distress. He has started to have thoughts of running away or disappearing and of suicide. He loves his family, and at this level of distress, he truly believes that they will be better off without him. Smoking as self-medication. This mum has turned back to smoking as a familiar way to manage her escalating distress. Mood swings. Her mood swings about. Sometimes she has felt enjoyment of her baby, but at other times she feels sad or irritable. Increasing frustration. Increasingly, she is feeling frustrated with her baby. She's getting a lot less sleep as her baby's sleep patterns have changed and they are harder to settle. Rough handling her baby. She has had a few flashes of wanting to rough handle or throw her baby into the cot, and once recently she did so. It's often when people have this kind of scary experience or urge to harm their baby that they will reach out to a service like Panda. Panda can help. Call 1300 726 306 or visit the website at panda.org.au.